The Health and Wellness Program is funded by the Family Violence Prevention Services Act, or the FVPSA, which is a government grant. The primary goals of the program are to support the health goals of the shelter residents, to create a healthy environment in the shelter, to create and facilitate support groups, and finally, to engage healthcare professionals and community health programs. In terms of supporting shelter residents' health goals, there are a lot of different areas to consider, not just physical health. To get you thinking, let's do an activity. On a piece of paper, make 2 columns. On the left side, make a list of barriers, or things that stand in the way of survivors obtaining medical care for their conditions or receiving other treatment like therapy services. These can be barriers put in place by their abusers, by geography, or by others' perceptions, just to name a few. On the right side, list some ways someone working with a survivor could help them overcome these barriers. Think of services you might connect them to, or ways to work around or past some of the problems you listed on the left side. That kind of strategizing is one of the things the Health and Wellness Program does. When a survivor within the shelter discloses a health goal, whether it's obtaining birth control, receiving services for a traumatic brain injury, connecting with a licensed therapist, whatever it may be, we brainstorm with them ways to overcome the things keeping them from reaching that goal. The Health and Wellness Program also strives to create new ways to make the shelter a healthier environment. There are a few different ways we do that. One is promoting healthy choices through food and exercise. The shelter provides an exercise area with a variety of equipment, and we invite volunteers to teach cooking and exercise classes to the residents. We also try to keep fresh produce easily accessible in the kitchen. If nutrition or exercise are interests of yours, we always welcome new ideas. We also keep a number of health and wellness resources organized for survivors to use and for advocates to utilize when working with survivors. Most of these are now on the Willow's internal website under the Health and Wellness tab. If you have a Gmail account, any staff person can invite you to the internal website. Promoting emotional growth and well-being are harder to define, but a large part of that is providing activities and support groups to residents and encouraging healthy coping and conflict mediation. The program also helps to address group living concerns. It's hard living with so many other people, and there are certainly times when our beds are full. Sometimes this means hygiene concerns, like finding new ways to help promote hand washing to prevent illness from spreading throughout the house. Next, we have a number of support groups in the community, some run by the program coordinator and some run by other staff. Support groups are an amazing opportunity to work with survivors in different settings. Every week, we have groups in the community, the Douglas County Jail, and First Step, the residential drug and alcohol treatment program for women. This is part of our effort to meet survivors where they are at currently and provide supportive services that promote emotional and mental well-being. Volunteers and interns are also welcome to participate in support group facilitation. Anyone who is interested in doing so, or even just sitting in on a group to see what it's like, can contact the program coordinator. Finally, we work to engage healthcare providers in the community. This means making sure hospitals, clinics, and other local health providers have up-to-date information about the Willow services. We also do a number of presentations about domestic violence in the community for healthcare professionals and other groups. Partnerships help us serve survivors in multiple areas of their lives. If you are interested in working with the Health and Wellness Program in any way, or if you have any questions or ideas, please contact the program coordinator.